Hello everyone, my name is Jyoti Beniwal and today we are going to discuss MCQ questions of renal system based on your NCLEX. So here are the questions and we will discuss the questions one by one and you have to choose the right answer. Let's start the question number 1. A client has undergone a cystectomy and an ileal conduct diversion. What should be the nurse incorporate into the discharge instruction? It's a SATA question. Select all that apply. So what do you think? You have just 5 seconds to answer these questions. Okay, just think what will be the answer. Okay, the answer option number 1 is drink at least 3000 ml of fluid each day. And the second right answer will be avoid odor producing foods such as onion, fish, eggs and cheese. Okay, so you need to know about we have to drink a lot of fluids to recover in the renal phase disease. And if we have cystectomy or we have some if we eat some odorous substances like onion, we will discharge some odor from that stroma, so it will be disturbing. So the answer number 1 and 4 will be correct. Now the question number 2 will be a nurse is caring for a client with an ileal conduit. When assessing the stoma, which of the following outcome are not desirable? It's again a SATA question, you have to select. You just have 5 seconds to answer this question. Okay, so the right answer will be dermatitis, bleeding and fungal infection. So during the ileal conduit, if we see there is dermatitis in the skin, bleeding at that area and some fungal infection, it is not fine. Okay, because it presents some leakage of urine, alkaline substance that cause this disease and bleeding at that place. Now let's discuss the question number 3. A client is admitted to recovery room after cystoscopy with biopsy. Before the nurse can discharge the client, the nurse should be make sure that the client has. Okay, just read the options and tell me the answer. Okay, the right answer will be 3. We have to make sure that the client have voided the urine, he passed the urine before the discharge, because if he didn't pass the urine, it will indicate the damage in the urinary system. Now let's discuss the question number 4. The nurse should assess the client with bladder cancer for which of the following? How could you predict the person have a bladder cancer? There are 4 options. Now you need to answer. Okay, so the right answer will be 3, that is painless hematuria. If a person feel blood in the urine without any pain, so it can be a cause of bladder cancer. So the right answer will be 3. Okay, now let's discuss the question number 5. A client is to have a cystoscopy. Which of the following indicate the client has developed a complication of the cystoscopy? So you have 4 answers and you just have 5 seconds to answer. What do you think? What will be the complication of cystoscopy? The right answer will be 2. Chills, swelling, fever. That is a sign of infection. After the cystoscopy, the person might get an infection. So the right answer will be 2. So it's a complication of cystoscopy. Now let's discuss the question number 6. If the client develops lower abdominal pain after the cystoscopy, the nurse should instruct the client to do which of the following? I am talking about lower abdominal pain after cystoscopy. If a person feels pain after the cystoscopy in the lower abdomen, what will the nurse should instruct to the client? The right answer will be answer number 4, that is sit in a tub of warm water, because the warm water will dilate the vessel there and it will reduce the pain at this area. Now let's discuss this question number 7. A client who has been diagnosed with bladder cancer is scheduled for the ileal conduit. The nurse reinforced the client's understanding of surgical process by explaining that ileal conduct is. So now we have to tell how could a nurse tell the patient what is ileal conduct is. You just have 4 options and 5 seconds to answer. Okay, so the right answer will be the answer number 4, that create an opening in the bladder that allow the urine to drain in the abdominal wall cavity. So there will be a stroma formation that will allow the urine to come out from the ureters in the external abdominal cavity. Now let's discuss the question number 8. After surgery of an ileal conduct, the nurse should closely assess the client for occurrence of which of the following complications related to pelvic surgery. So there are 4 complications in the option and you have to tell which of the complication will occur after the ileal conduct surgery related to pelvic surgery. So answer fast, you just have 5 seconds to answer. The right answer will be answer number 2, that is thrombophlebitis. That is the clot formation in the wings. So it is a pelvic complication that mainly occur after the ileal conduct in the pelvis. Now the question number 9 we will discuss. The nurse is assessing the urine of client who has had an ileal conduct and notes that the urine is yellow and moderate amount of mucus is present. Based on the data, the nurse should. What the nurse will do if the patient is complain about the yellow color of urine and moderate amount of mucus. Try to answer this question. This question is very easy. The answer number 4 will be correct. Encourage a high fluid intake. If we increase the fluid intake, it will decrease the specific gravity of the urine and the urine color is resolved, that will go to the normal range. If you see yellow color of the urine, it will also indicate dehydration in the body. So we have to drink enough amount of water. There is no need to notify to the physician. Now let's discuss the question number 10. When teaching the client to care of an ileal conduct, the nurse instructs the client to empty the appliance frequently. Which of the following indicate the client is following the instruction? You have 4 options. Just look at the option and choose the right one. The right answer will be answer number 4. The seal around the stroma is intact. Now you will ask why the answer number 4 is right. Because if the patient is emptying the appliance frequently, there will be less amount of urine in the appliance and that will offload the pressure. Without any pressure, the seal will be intact. If the patient is not empty the appliance frequently, there will be a lot of pressure of urine in the appliance and that will break the seal. So the answer number 4 is correct. Now let's discuss the question number 11. The nurse should teach the client with an ileal conduct to prevent urine leakage from changing the appliance by using which of the following procedure? So the question says when someone is changing the appliance, what will the person do to prevent urine leakage from the stoma side? So you have 4 options. Try to solve this option. You have 5 seconds. So answer number 1 will be the correct answer. Insert a gauze wick into the stroma. That is very easy because when someone is changing the appliance, we can put the gauze on the stoma side to prevent any leakage from of urine from the stoma and abdominal cavity. Now the question number 12 says, the client with an ileal conduct will using a reusable appliance at home. The nurse should teach the client to clean the appliance routinely with which product? If a person is using, a client or a patient is using a reusable appliance, so the nurse, how would you teach the patient to clean that appliance regularly in the routine? So the right answer will be the answer number 2. With normal soap and water, we have to clean the appliance with normal soap and water. No need to use alcohol, hydrogen peroxide and baking soda, it will make the condition worse. Now let's discuss the question number 13. The nurse is evaluating the discharge teaching for a client who has ileal conduct. Which of the following statement indicate the client has correctly understood the teaching? It's again a SATA question. You have to select more than one answer. Just read the option and select the right answer. So the right answer will be 3, 4 and 5. The option 3 says, I can usually keep my ostomy pouch for 3 to 7 days before changing it, and that is absolutely right. And option number 4, I must use the skin barrier to protect my skin from urine, because sometimes the urine, because of infection and UTIs, the urine may become alkaline and it may irritate the skin. So it will be good if someone is using skin barrier to protect the skin. And I should empty my ostomy pouch of urine when it is full, and that is absolutely fine. Now let's discuss the question number 14. A client has an ileal conduct. Which of the following solution will be useful to control the odor in the urine collection bag after it has been cleaned? So this is very concerning. We have to be maintain the collecting bag odor free. So which solution we will use? The right answer will be second, that is vinegar. Vinegar is a good cleanser and it diminishes odor very quickly. So the right answer will be vinegar. We can use vinegar to clean the collecting bag and stop the odor in the collecting bag. Now the question number 15 is on your screen. A female client who has urinary diversion tells the nurse, the urinary pouch is embarrassing. Everyone will know that I'm not normal, I won't see and something in the public anymore. What is the appropriate nursing goal for the client? This is the priority based answer. If someone is feeling embarrassing about his or her disease condition, what will you do? You have 4 options. Just read the option and tell me the right answer. What will you think about that answer? So here answer number 4, option number 4 is correct. That is express fear about the urinary diversion. We have to ask the patient to tell everything, every concern about the condition, what they feel, what the sick fear about that condition. So answer number 4 will be correct in that case. Now question number 16. The nurse teaches the client with a urinary diversion to attach the appliance to the standard urine collection bag at night. The most important reason for doing this is to prevent. So you have 4 options, just pick one right answer. What will you choose? If someone is connecting the appliance to the collecting bag at night, what will the answer according to you? The right answer will be first, urine reflects into the stoma. We know that from stoma the urine will pass out and it will collect into the collecting bag. But in case the collecting bag is filled and the urine may get back into the stoma, so to prevent this we have to attach the appliance into the collecting bag at night. So this will be the right answer. Now let's discuss the question number 17 on the screen. The nurse is teaching the client with an ileal conduct how to prevent a UTI infection. Which of the following measure is most effective? What do you think? To prevent a patient from UTI, what will you do? Just read the options and tell me the right answer. Okay, so answer number 2 is correct. Maintain a daily fluid intake of 2000 to 3000 ml, and this is the very important answer in the renal system. We have to maintain the intake of water in that range, at least 3000 ml, that is 3 liters we need to take to prevent any kind of UTI, because if we drink a lot of water it will flush out all the bacteria and it will reduce the chances of UTI. Now the question number 18 is on the screen. The nurse evaluates the effectiveness of client's post-operative plan of care. Which of the following would be expected outcome for the client with an ileal conduct? And the 4 option is on your screen. Just tell me the right answer. The right answer will be 4. The client will empty the drainage pouch frequently throughout the day, and that is very important. Whenever the pouch is filled, we have to drain out the urine very frequently, and this is the major teaching we can teach a client. Now the question number 19. The client is scheduled to undergo weekly intravesical chemotherapy for the bladder cancer for next 8 weeks. Which of the following indicate the client understand how to manage the urine as a biohazard? So you have 4 options, just read the option and tick the right one. Okay, so if we are going undergo some chemotherapy procedure for the bladder cancer, okay, so the urine and some extra items will be biohazards for us. We have to discard the things very precisely, right? So the right answer will be answer number 2, disinfect the urine and the toilet and beach out 6 hours following. Okay, so the time is over. Now we will discuss the more question in the next session. Thank you.